him back, so now we're back in Houston. And I was here before. From Tennessee, I came to Houston, and I worked at a larger hospital in the Memorial Hermann system, but I did ER there. And then from there, I went to a smaller hospital and there, and then went traveling. So I've been around the Houston area a little bit.
Wow. It seems like a lot of this experience has helped play a huge part as far as getting past communication barriers with people, whether it be through language or culture or anything of the nature you say.
And communicating isn't just verbal. I mean, as we all know, when we travel to a foreign country and don't know the language, we can use hands, expressions, signs, and body language plays a big role. So I've learned a lot about my body language over these years too, as a way of communicating and not communicating. You want to keep it positive, so you have to
maybe ways you've seen patients through body movements, you can kind of tell
who's the sickest or who's upset, who might need a little extra TLC, or you can kind of pinpoint maybe without even talking to them where an injury might be. They're limping or they're doubled up in pain. Certain things like that. You look in their eyes and just know, okay, they can't fake it.
Right.
Sometimes your body language means you're not faking, you're ill. They need your attention, and that helps because you supposedly have like 3 minutes to make first contact. You can make a big impression in your first 3 minutes.
Oh wow, okay.
So we talk about communication. That's like 3 minutes. It can make a difference.
So in 18 years, has there been anything that sticks out of your mind that you couldn't get through to someone through a means of communication? Has there been any event at all that pops out, or have you been able to get past those barriers as far as communication?
I think there's been, without being a language issue, sometimes you have to get someone they can finally interpret. That seems to be the most puzzling. Or sometimes at their education level, you're so used to using certain terms amongst your coworkers and things like that. And not that you can't get past anything, but you might have to go back and simplify. Or the doctor will go in and explain something, and they have the nurse to come behind and say, he just told me, da-da-da-da-da, can you explain it to me? So a lot of times it's re-explaining something down to their level, or to the parents, because they hear one word and they lose it after that. Like if you were diagnosed with cancer, all you hear is the word cancer. You didn't hear a word and pass there.
Right.
So you have to kind of think, say, if that was you, or someone just said that to you, what would you do? So sometimes I've had it where patients just didn't understand, so then you'd go get someone else to try and explain it. And maybe just the way they worded it, it clicked. So it's not that you failed per se, just they weren't comprehending. I don't think I've had one that I couldn't overcome, unless be a psych patient. We see a lot of psych patients in the emergency rooms because they have to have a medical clearance to go.
Okay.
So they're probably the most difficult sometimes to get to understand, because they may be having a total breakdown. And I do remember one out in Arizona, this person was having a total breakdown and just did not comprehend. So you have to find someone else who's been taking care of them, related to them, family, to bring them in.
Also,
because
that's how you get past it.
That's how I would get past it, because if they don't understand, how can you treat them? How can you make that call? When it's a life or death situation, that's different. But when something like this, you have to find someone who then can take care of them, or can make that call for them. So then you have to call the other. Like it could be a friend, or their doctor, or someone. They can say, yeah, I agree, we need to do that. So because then you get the legal issues involved. We don't like the legal issues. We just want to take care of patients.
Right.
So that's psych patients probably ones that we most difficult with communication, when they truly having a psychotic episode, because they can't, unless they're medicated and get them back on track. But it takes a while, and in emergency room we don't like to keep them longer than they have to, because it's not a conducive environment for them to rest and get better, because it's so busy, it's so chaotic, noisy. There's a lot that people say it's too noisy in here, I can't rest, and it is noisier than say on the floor. If you're just in a basic room on the floor, the ears aren't noisy. But psych are probably the most difficult. But then everybody else would have someone with them. Or the homeless. They can understand. They just may not have anybody as backup.
Right.
But nobody they can understand. Or they're drunk, and when they sober up, they can understand.
That could cause a problem for communication at any point. And so how much, Mary, longer do you see yourself being the triage nurse?
I've thought about trying some different things. Sometimes you think, well, I still haven't learned everything. So I don't think I've reached the burnout, because traveling was good, for burnout per se. But I always told other nurses, I said, you don't learn something new every night. You need to reevaluate what you're doing.
Right.
And each night is different. That's the nice thing in the ER. We start fresh. Occasionally you'll have a patient that was there when you left, but that's rare. But to do other things, I like teaching the younger ones coming in. I like teaching the younger nurses. But I don't want to go back to school at my age to do all that. I don't want to be bored either, because we do ER because we like the fast pace. We like the constant push on, are we going to know what to do? But I thought about, a cushy job sometimes. Maybe I would like to, maybe getting people ready for surgery, pre-op, post-op, things like that, because you still don't have them for that long. So
Right.
there's a similarity. But I'm probably going to do it till I retire. Hopefully under 10 years I can retire.
Great.
And keep it going. But you can all find something to do. Home health, different things that you can, by working in the ER and everything, you've got such a broad range of things that you've assessed that you can find something else. I mean, I guess if I got a disability where I couldn't be on my feet and handling the gruel of 12 hours on your feet, then I'd have to find something else. But other than that, I plan on keeping doing it, because it is an adrenaline rush. It doesn't have to be the big trauma. That is an adrenaline rush when you do that. But just the fact knowing that you've dealt with all these difficult people, or these ill, and they're all breathing when you leave. That's what we said. We've done our job because they're all talking and breathing when we leave.
Gotta feel rewarding.
Mm-hmm. So that in itself is okay. We've done our job. And that's a good feeling. And when you get a thank you, one thank you can make your whole night, or your whole shift, just by one person thanking you. Because we don't get in it for the gratification. We get in to help the others. And if someone does thank you, that's just icing on the cake.
Sounds very genuine.
Mm-hmm.
You mentioned that being a triage nurse gives you that adrenaline rush and that in and out factor for the patient being there so shortly. Did you ever see yourself getting emotionally attached when you were a staffing nurse to those patients who were there 3 to 4 days at a time?
I think you got to know them a little better and their family. And if you didn't get attached a little bit, they would think you weren't a caring nurse. But I prefer, now that I didn't have some great patients that you took care of, and great families, I just prefer the shorter, just constant, different things. So you're kind of pushing your knowledge.
Kind of like a new challenge, fast challenge.
Like, like every day you got something different going on. Because each day you don't know what's going to walk in that door.
Kind of curious out here. How many, just on average, do you think, guesstimating, would you think you see in a day of 12 hours being a triage nurse?
If I'm out there for 12 hours, which I am quite often, I save my little paper sometimes with the vital signs on it. I think the average is probably 40.
Wow.
I've had many as 5 an hour. You're supposed to do it, that's why I said it's got to be quick. Yeah. And then when you get the critical ones in, that slows you down a little bit because you got to make sure they get back to be seen. We pull people out of cars, all kinds of things. All different things, yeah.
Out of cars?
Yeah, well, they can't get out. Like they're so sick now, or they're in so much pain, or they can't breathe, and they're laying in the car, so we got to go get them, bring them in. So there's all kinds of things you got to look at. Or ladies in labor, we don't delivering the baby in the car.
Wow.
So it varies from like someone who's going to give birth to a baby to an elderly person who's having a massive heart attack sitting in the car.